Mount Sinai is one of the top hospitals for ophthalmology.
The eyes really do tell physicians a lot about the rest of the body.
Ophthalmology is a field of medicine where we deal a lot with the care, treatment, and diagnosis of ocular diseases and illnesses.
Ophthalmology is probably one of the most subspecialized fields in medicine. You know, we have about 10 different subspecialties.
The key role of an ophthalmic assistant is to help the doctors in ophthalmology become more efficient and then also allow them to see more patients, because at the end of the day, like, if the doctors had to do every aspect of the care for ophthalmology, from, you know, checking the patient's vision or like any diagnostic testing, it would just take them a really long time during the daytime. So the ophthalmic assistants help them to gather that information so that way they become more efficient in the clinics.
Ophthalmic technicians are critical to my day-to-day. They're usually one of the first people to meet and greet the patient. They will take the patient history. A lot of them will perform a glasses check for me and also refract the patient, which is fitting them for glasses. And then they send the patient on to me. Sometimes they'll actually perform testing as well on the patient.
In my day-to-day activities, ophthalmic technicians are vital contributor to everything that we do. They make us more effective, more efficient, and without them, we couldn't do our job. They are extremely important in gathering all the information that we need to do our job.
I think my favorite part of the role would actually be the direct patient care hours that this role allows me, and that's actually a big reason why I love this job. So when I first started here, I had no prior experience with patient care, and for me, this kind of solidified my decision to be in healthcare. And you know, I get to be one of the first people to welcome them to the clinic, and you know, hopefully be a smiling face and somebody to ask their questions to.
I think my favorite part of the role would be the conversations I'm able to have with the doctors about the imaging that I do. It's very much, I feel like it's a collaborative relationship that I have with the doctors. They'll come in and check out some of the scans I've done, and they'll kind of explain to me what they're looking for. That's probably my favorite part, is the conversations I have with the doctors and what I'm able to learn, of course, besides working with the patients as well.
There's been more advances in technology and ophthalmology in the past 50 years than there has in all of human history. You know, like for instance, this is an autorefractor, which will give us an estimate of the patient's prescription. When I started, this machine would take up half of this room, you know, and this is how far we've come.
The only requirement for becoming an ophthalmic assistant at Mount Sinai is a high school diploma, which is really good because if you're somebody who wants to get into the field or wants to, you know, try out healthcare, you know, it's an easy way or an easy pathway for somebody who does not have any experience at all in healthcare. So what we're looking for when we're looking for candidates is somebody who's motivated, who wants to learn new skills, and somebody who's, like, you know, compassionate, somebody to be compassionate to take care of our patients.
I got all of my healthcare experience from here. I have just been accepted to a physician assistant program, and I feel like it has given me the foundation that I need to move forward in my career as a healthcare provider.
There's many different levels for ophthalmic assistants and like many roles that an ophthalmic assistant can play in ophthalmology. So the different levels of certification includes COA, which is Certified Ophthalmic Assistant, COT, Certified Ophthalmic Technician, and then COMT, which is Certified Ophthalmic Medical Technologist. There's also different certifications that you can obtain, such as Surgical Assistant, Scribe, ultrasonographers, or like certain types of certification that you can get for clinical research or, you know, imaging devices as well.
I feel like being an ophthalmic technician here has sort of solidified my decision to go to medical school, mainly because of the more challenging interactions I've had here. In terms of a patient who may be in a tough spot in their life at that moment and they're kind of in need of something sort of beyond objectively assessing what they have. Being able to come through for patients like that in those moments are what are most valuable to me in medicine and working in the medical career. And those moments are really what will carry me forward, I feel like, in my pursuit of my medical career in the future.